Good morning, everyone, and welcome to the 2021-2022 beginning of Cybermentoring for our PATHS3 workshop that we're having. We're so excited to have students with us and to welcome our guest. This month, we're talking about respiratory therapy, and we're welcoming Lottie Kubria. Lottie is a respiratory therapist at DHR, and she will be telling us a little bit about herself. Welcome, Lottie.
Hi, thank you so much for having me, Claudia. So I'm just going to go over what respiratory therapist is, what they do, how to become one. So basically, a respiratory therapist is a practitioner that helps patients who are having trouble breathing. Respiratory therapists work under the direction of doctors and treat a range of patients, from premature infants whose lungs are not fully developed to elderly people with lung disease. They give patients oxygen, manage ventilators, which is a life support machine, and administer drugs to the lungs. To become a respiratory therapist, the minimum degree is an associate's degree. You can go further and advance your career, but to work as a respiratory therapist, the minimum is associate's degree. So our scope of practice, we assist with diagnosing lung or breathing disorders. We evaluate patients, perform tests and studies. We determine appropriate therapy and treatment options with physicians, analyze blood and sputum in the lab, manage equipment devices needed to help people that can't normally breathe on their own. We also do a lot of education. We educate the patients, the families about lung diseases and breathing disorders to make sure that they're competent, they feel good when they take a patient home, if that's part of their plan. So, some specializations that we do work in, we do neonatal, pediatric, geriatric. We can do pulmonary rehab, critical care, home care, and some of our work environment. The majority of respiratory therapists, they do work in hospital. About 75% of respiratory therapists work in the hospital. Typically work about 35 to 40 hours a week. And we do 12-hour shifts if we're working in the hospital. Depending on where we work, we may work nights, weekends, holidays. And we do direct patient care in hospitals and nursing homes. So like I said, to become a respiratory therapist, it is an associate's degree. The way I became a respiratory therapist, I went to STC, that is here in McAllen. You can come here, stay here in the Valley if you want to get your education done. The way I signed up, and the reason I wanted to be a respiratory therapist is because I have one daughter, she's 16 years old. She does have asthma and breathing problems. So I just wanted to be able to help her more and become more familiar. They do require prereqs. It's about the same as the nursing degree, the radiology degree. So if you are uncertain at the time, it's the same prereqs that can be done. So I signed up for X-ray. I signed up for nursing. I also signed up for respiratory therapy. So I left it up to faith. I said, whoever gives me that acceptance letter first, that's what I'm going to do. So respiratory did reach out to me, and that's what I did. Went to school at STC. I've been working here at DHR ever since I graduated. Been here 10 years. Love it. I like that I have the freedom there at the hospital. We just don't work in one floor. We have multiple floors. So we're able to engage with a lot of your employees, patients. You get to roam around and help everybody. Mm-hmm. So starting salary for respiratory therapists is about $62,000 a year. That's like starting. So it's a good job, a good career path. We are rising. There is going to be a lot of jobs for respiratory therapists, especially with COVID. It brought to light the respiratory therapy program because COVID is a respiratory disease. So we had a major impact during COVID. We were there from the beginning, from the patient gets admitted to the end. Unfortunately, if they didn't make it, we were there. If they did, we were there as well. So any questions, Claudia, for me?
Yes. What's your favorite part about what you do? Because you've been there 10 years. So obviously you don't stay at something 10 years if you don't enjoy it. So what's your favorite part about your job?
Like I said, we don't really have to stay at one place. We do get to roam around. We take care of the whole hospital. So just doing different floors, it's a different thing every day. It's not, we're not going to be sitting somewhere and just doing paperwork. We do get to walk around. We treat our patients, we assess them, we go different places around the hospital. Also, if you want to do home health or something like that, you would be treating patients, helping patients with their equipment at the home. So there's a lot of different things you can do. It's not just one specific thing.
Okay. Oh, that's great. What do you find most challenging on your job?
Most challenging would be end of life for the patient. When it's determined that their quality of care can't be treated and they are going to be passing, we are the ones at the very end that take off the life support. It's not something for everyone, but that would probably be my least favorite thing.
Right. Oh, I can imagine. Yes, it would be. How do you feel about working with colleagues? Do you find it's easy to work with other people? Do you find you do a lot of your work alone? What type of work environment do you find in what you do?
So basically, when we do walk into the hospital, we're given an assignment, which floors we need to be on. So you are, for the majority, on your own. You have to be very well at time management, being there at a certain time, making sure everything's organized. But I mean, you do run in with colleagues. You work mostly with doctors, the doctors and the nurses. So you have to be a friendly person, people going.
So what do you think is difficult about what you do, about being a respiratory therapist, besides the end of life, but just your day-to-day? What's the most difficult?
I feel it is a high stress environment. We do have to be there in emergencies. They're called code blues, when the patient's heart stops or they stop breathing. So we can have multiple emergencies throughout the day on top of our assignments. So we do have to worry about our time management skills. So I would say about when an emergency arises, just high stress level situations.
Yes, I can see that. Other than what you've dealt with during the pandemic for COVID, what diseases or conditions does a respiratory therapist help treat?
Okay. We do asthma patients, COPD, sleep apnea, any stroke patients, any car accidents that come in. They need to be intubated, put on the life support machine will help with that. We also do at the office, we work in an office setting, you could be diagnosing COPD, diagnosing asthma, giving breathing treatments, taking blood, giving medications, stuff like that, different diseases.
You did mention that you work in the hospital and that some respiratory therapists work in home health, but where are some other areas that you would find respiratory therapists working?
We do clinics. Some people do pharmaceutical reps where they go and show other respiratory therapists how the machines work that they're using. So they could be a medical rep, they could do office work, they could do DME, which is traveling, setting up ventilators for pediatric adult patients, nursing home. If the nursing home patients need breathing treatments, or if they have a trach, I don't know if they've seen this, but it's like it goes inside your throat. If they have one of these, we will be working with them in the nursing home or anywhere in the home.
Okay. So let's go back to before you became a respiratory therapist in high school. So if if you were back in high school and you thought about doing this, are there some things that students can do to, first of all, learn more about being it, to see if that's a good fit for them? Or what suggestions would you have for high school students who are interested and become a respiratory therapist? What are some things that they could start doing?
Definitely, I know there's health science that they can enroll in. We had that even when I was in high school. So health science is a great start. They do have volunteers here at our hospital. I think it's 16, the age that they can start volunteering. I'm not sure, or 18. But you can volunteer, help with, so you can get a more in-depth knowledge of the hospital setting, stuff like that. Right. And just volunteer maybe at a doctor's office where they do pulmonology, stuff like that.
Okay. So then when you start going to school and you're taking the classes, so it's a 2-year degree, it's an associate's degree. Right. Is there anything that you can do in respiratory that takes less than 2 years, like a certificate program, or is that the entry level?
Entry level would be associate's degree. You can further your education, but it's whether you get a bachelor's or a master's, it's still the same. You could still do the same scope of practice as the associate.
Okay, so that's my question. So after you become a respiratory therapist, and you've been doing it 10 years, let's say you want to grow, you want to expand, what further education can you take, and what can you become beyond a respiratory therapist?
Well, beyond the respiratory therapist, a lot of people will branch out and maybe do CRNA.
What is that?
With anesthesia. With anesthesia, they'll help in surgeries, put the patients on the machine so that when the doctor's doing their surgery, they make sure that they're well sedated, they're asleep, they don't wake up, monitor their values. So I know a lot of therapists, they'll do from RT to CRNA, or they'll do RT to doctor. There's not really much above an RT other than CRNA or doctor. A lot of people do the healthcare management portion. If they want to advance their degree, they can do healthcare management, which is director of respiratory therapy. If they want to teach at a school, at a college, they do healthcare management degree.
I didn't think about that respiratory therapy would connect to anesthesiologists, because it is all about breathing and
correct.
Yes, that's a good connection. Thank you for bringing that up. So besides an education, what are some other skills and traits that would be good to have if you are someone who wants to go into respiratory? I'm thinking more like soft skills, maybe not medical knowledge, but beyond that. What do you think a person would need to have or know to be able to do that?
Good communication skills, interpersonal skills, very organized. You have to be organized. A strong background, math, science, because you are working. It is life or death sometimes, so you have to be precise. So just good organizational skills.
Okay.
Like that.
And can you tell me a little bit about your background? You mentioned your daughter. Can you go into a little more detail about how did you decide that you wanted to be a respiratory therapist?
I knew I wanted to help people. I knew that I would have a for sure job in the medical career. I wanted something where I was needed as well. Medical professionals are always needed. It's not going to be a degree or a career that's going to be died out. There's always going to be a need for medical career persons. And that's what I just wanted to help people, I guess. I'm real friendly. I like people. I like working with everybody. And I just wanted to stay here in my community.
Right.
I didn't want to travel anywhere. I didn't want to have to travel for a job. I just wanted to stay here where I grew up, where my family's from. And so I figured it was a good fit.
So what are your long-term career goals?
I would say my long-term career goals is I do want to advance and be a director, be in the healthcare management, like administration portion of respiratory therapy. So that's where I see myself. I do see myself staying here at DHR in the long run because I love everything about DHR. I love they're like my second family.
We love DHR also, so that's great. What advice would you give students who want to go into respiratory therapy?
Advice, let's see, just anyone, you can do anything, anyone can do anything as long as they put their mind to it. Just study hard. It'll have its challenges, but I think it's a high reward. You get to help patients, you get to save their life, you get to, it's comforting knowing that you're helping another person.
What advice do you give to someone who, like, first day on the job? Well, besides all the paperwork you do when you start working someplace, but what advice, like first day?
Advice, I would tell them you do have to have tough skin to work as a respiratory therapist. You're going to have some good days, you're going to have some bad days. I would say not to take it personally. Don't take your work home. In the end, you're here to help patients. That's what you're here for.
That's good advice for any job. So that's really great. Was there anything once you started working that was unexpected, that surprised you about being a respiratory therapist?
Just time management. They basically give you an assignment. You're in charge of how you want to manage your patients. You're not being overseen directly all day long. So it's really up to you to choose your time wisely, and so you can get to see all your patients that are assigned to you.
Okay. Did you feel like there was anything difficult that you had to deal with when you first started working?
Difficult? I guess people's character. Since it is a high stress level job, and so are the other positions in the hospital, people do tend to be, I guess, blunt, or not blunt, but direct, very direct. Very direct.
Very direct. Yeah. So tell me what a typical day is like. So you get to work, and tell me like what a typical day might be.
Okay, so I come in, I do a 6 a.m. to 6 p.m. shift. I come in, I go to our department, respiratory department, where our assignment is laid out for the day. We'll get, we don't get patients, we get floors. So we can have about 3 to 4 floors at a time. The majority of our therapy would be giving breathing treatments, where we put medication into this nebulizer.
Right.
And it helps open up the patient's lungs. It also helps with inflammation. So we can be giving breathing treatments about every 4 hours. So it is a lot of breathing treatments that we do. We do, on top of that, we do manage the ventilators. We manage non-invasive breathing machines called BiPAPs. So we'll be taking down the numbers on the values of the machines, just to make sure that they're working properly, the patients are getting better. And then as well as that, we do answer to code blues, we answer to rapid responses. Anybody that's having any issue with their breathing, we respond.
Do you work with doctors or nurses more?
Both, equally the same, because the doctors, they are here for the majority of the day. We have several doctors that we work with. When they are on critical care with their breathing machine, they will make changes to their plan of care regarding their pulmonary breathing. And I mean, we directly, both nurses and doctors we work with the most.
Then how do you plan for the care of the patient? Do you set up their plan, or do the doctors set up the plan?
The doctors sets their plan, and we oversee it. We
Okay.
oversee it. We will tell them if they're getting worse or if they're getting better. We give recommendations. And some doctors, if they're familiar with you, they will let you do more. If they feel comfortable with you, they will let you manage the machine by yourself.
Right.
Mm-hmm.
And I know that most students and educators will have heard of a code blue. Can you tell us a little bit about what a code blue is? Who responds first? How can you give us a background on that? Because I can tell you I've seen it on TV, code blue, but I don't know that I exactly know what that means.
So basically, a code blue is when a patient's heart stops beating or they stop breathing. The persons that need to respond is for sure a doctor, a nurse, and a respiratory therapist. Those are the three main people that need to respond. My role in a code blue is as soon as I enter the room, I get what is called an ambu bag. And basically, this is going to be placed on them so that I can give them oxygen and help with their breathing. So I'm going to be breathing for them.
Right.
While I'm doing this, the nurse or another respiratory therapist will be getting all the materials needed to intubate a patient. So basically, we have a tube that's called an ET tube. When the patient is not breathing, they will be intubated with an ET tube. And this is the tube that's placed on with the life support machine.
Okay. So
our role is we get in the room, connect the ambu bag to oxygen, make sure we have suction available, we have our machine available. Then there will be somebody that will be doing CPR, actually doing compressions. The nurses will be getting the life support medications needed. They'll be getting epinephrine. They'll be getting everything needed to restart the heart or anything like that, anything that the doctor orders. The respiratory therapist and the doctor are the ones that put in the tube. So we're right there next to the doctor when we're doing a code blue.
Okay. Thank you. I'm glad that you brought the equipment that you use, because I think it's really important that students see that that you have to not only have the knowledge, but the skills using the devices on top of that. So how did you learn to use those devices?
When we do our degree in respiratory therapy, our last year of in college, it is skills. So we have to come to the hospital, and we do the same shift, 6 a.m. to 6 p.m. We'll be directly with a respiratory therapist. We are a teaching hospital here at DHR, so we will get some students. We take them under our wing. We show them what we do. We show them how to set up equipment. So when they graduate, when a respiratory therapist student graduate, they have firsthand knowledge. I felt confident as a student when I graduated that I could perform my job.
Right. Can you give us one unique experience that you've had in your career? Is there something that stands out that you'll never forget?
One thing I guess would be with COVID. I was the first therapist to enter our COVID unit here at DHR, and I was the first therapist to successfully extubate a patient, which means I took them off life support and they survived.
Oh,
so that was rewarding.
Yes, I'm sure that was. Tell us a little bit about COVID and the challenges that it has presented for being in respiratory therapy. I think let me correct. I don't know that all students will understand the connection between respiratory therapy and COVID, which I think is probably huge. So if you could go in more detail about that.
So our connection with COVID is it is a breathing disorder. When the patient does get bad with COVID or they're having trouble breathing, it's kind of like a code blue. We have code blue situations. We will intubate them, put them on life support. So we are there from the beginning of when they enter with COVID to the end. So we put them on oxygen. Say you're a patient with COVID that just entered. you're not doing well, you're not feeling well, you're not breathing well, your oxygen saturation is low. You come in, the first thing we do is we assess you. If you're not that short of breath, so critical, we will place you on oxygen. So we'll put like a nasal cannula on, put you on oxygen. The second thing we do is we do draw blood. We draw blood usually from the wrist. It's called an arterial blood gas that we do. It measures the oxygen saturation in your coming from the heart. It's basically it's not from the vein. It's actually from an artery.
Right.
So it's monitoring the blood from directly from the heart, and so that will give us a baseline of how we should be treating you. What our next step would be. Say you're not doing well after having the oxygen, we do put you on something that's called a high flow. It's basically another cannula, but it's bigger and it's more powerful. Our next step after that would be, if you're not tolerating that, you're still short of breath, we could put you on a non-invasive, kind of non-invasive ventilator. It's called a BiPAP. It's a mask that covers your nose and your mouth, and it delivers positive pressure. Basically, when you inhale, you're going to get some pressure. When you exhale, you're going to get some pressure, just to lessen your work of breathing. And then worst case scenario, you're not tolerating that. That's when we put you on the life support machine. So we're there basically throughout the whole time that the patient's there with COVID.
Right. Who's responsible for intubating patients?
Some facilities let the RTs intubate. Here at DHR, our women's section, the respiratory therapists do intubate the babies. On the adult side, we always have a doctor available, so they're the ones that take over and we assist.
And are there any current trends or issues in respiratory therapy or advances that you can talk about in respiratory field?
What do you mean issues?
Anything that's new, and like, can you talk about some of the treatments for COVID besides, there's different treatments that they have for COVID?
Right. Okay. Here, the treatments that we use was the ones that I explained. We use a lot of oxygen therapy. Once they're in the COVID unit, we do begin nebulizer treatments with some steroids. It's called Pulmicort. That was shown to be effective, the steroid medication.
Yes.
But it's just oxygen therapy, medication, and more comfort. We just want to relieve your work of breathing.
You talked about working with kids and adults and all ages. So is there special equipment for pediatric patients?
There is. So I will show you a difference. So basically, all the stuff we have for adults, we do have for kids, which is a mini version. So this would be for an adult. This is an adult ET tube. And then this would be for a kid. So it's almost the same, just mini version.
Just tiny.
Yeah, tiny. We do give breathing treatments for kids. Basically, it's the same. We just switch the mask and put a smaller mini version on. And we have everything for an adult, for a kid, but mini. We have these for kids too, and the mask, it would be a lot smaller, like half the size.
Okay. So tell me your favorite part of your job as we wrap this up. What's your favorite part of your day-to-day working life?
Favorite part, I would say, is just seeing the relief on, I would say, family members and the patient when they see that you help them, they feel better, they can breathe. Just that's rewarding in itself. Just knowing that you help them and they're at ease. That makes it all worth it.
Lottie, I want to thank you very much for joining us today. We've learned a lot about respiratory therapy. I'm so thankful that you've taken time out of your busy day to come and join us. And we hope to hear more in future months about all the different departments at DHR. They're such a good partner, and we want to thank them also for asking you to join us and providing this information. Thank you.
Thank you so much for having me. Thank you, everybody that joined. Have a great day.
Thank you. Bye.
Thank you. Bye-bye.